What were you trying to find out with this study?
So we were very interested in this idea of the indirect effects. So what do we mean by that? We understand the direct effects, those related to the virus itself, the illness, etc., hospitalizations, all of the things that we've been talking about. But actually the indirect effects are of great interest to us. And I think if you're a parent out there, you'll certainly understand that. And so that's the effects related to just being in a pandemic, related to the public health restrictions. So that includes the lockdowns. It includes the lack of access to certain services and, of course, the school closures.
And what did you find?
So we found, not surprisingly, that there is substantial indirect impacts on children and their families. So we were looking at both. And in particular for younger children, the impact on parents is really important because we know, and we found out through some of this work, for example, that parents with younger children really had high levels of mental health distress, whereas for older children, really they had the higher levels of mental health distress. But we also found physical health. Internationally, for example, there are increasing rates of obesity across the world, like increased screen time, lack of access to normal play, etc., and then lack of access to the services we would normally take for granted or that people were avoiding. So a substantial decrease, for example, in access to dental services.
In the research, Sharon, you talk about a generation-defining disruption. That's significant and alarming statement.
It is, and I guess you could look at it two ways. One is we've got this generation-defining disruption, which I think we can all agree that that is definitely how it feels. The flip side of that is what are the things that we could do that make the most of this generation-defining disruption? So what are the opportunities we have to really do things differently as we emerge out of the pandemic? And in this research, we looked at what's happened in other pandemics and some of the longer standing implications, mental health implications of that. But I guess looking back even further, the Spanish flu, World War II, there's actually quite a lot of innovation that happened as a result of that. And I guess we would look at this two ways. Number one, generation-defining disruption. Number two, generation-defining disruption leading to innovation that perhaps at this point in time, maybe can address the inequities we have for Australia's children.
Just to focus on the positive side then for a moment, what are those innovations? What could they be?
We focused on a number of them in this paper, but I'll talk about them briefly. But if you have a think about it, in the disruption that we had, we moved to telehealth, for example, in 2 weeks. It had a 10-year agenda. So, wow, what does that mean going forward in terms of access to equitable care for children in health, education, and social care? And maybe them all working together in a different way to think about how do we really deliver services to children? We had JobKeeper and JobSeeker. Wow, that was amazing. Maybe it's time to think about what sort of resource parents might need, particularly for young children. Is it an opportunity to talk about, say, a parent supplement where we gave more money to families? Just to give you a sense of this, in taking the pulse of the nation, 68% of parents were suffering some form of financial distress during the pandemic. So a real opportunity to do things differently as a result of the pandemic.
Okay, so what is the advice then to the parents of younger children and to older students directly? What's the best way to get everybody through this?
So I think we've all been hearing about this in the media. The most important immediate thing is to get kids back into school this year. Everybody will be aware, everyone's talking about it, how challenging that's going to be. But really for kids, schools are the fundamental game changer for them and for their life trajectory. So getting them back to school. And also for schools, they've also had incredible disruption. Teachers have done an amazing job. But wow, is this an opportunity to think about children's health and well-being as much as we think about their literacy and numeracy, and have schools as that really integrated platform for children? So for parents going forward, they will all be saying getting them back into early childhood education and care in schools is so important. Getting them back into their usual social interactions in ways that everybody feels comfortable with, so important. And vaccine and vaccination are central to that. And then, of course, what we've been saying all along, talk to your kids, listen to what they have to say. There's an enormous number of mental health supports being sprung up around Australia. They might be needed But we might just find, and it's maybe a bit too early to know, that getting kids back into school, back into routines is just the remedy we needed.